Let's start with an extreme case. This patient came for full mouth rehabilitation. She's a 39 years old female and suffers for 20 years of extremely severe anorexia. It means that she was between life and death. And when she came, she was like this. The weight was 39 kilos, very miserable patient, but very extremely clever. She was a veterinarian, a very bright person, an interesting person. But the problem is that she was living as a miserable person by herself, going from hospital to hospital. And she was having this kind of restoration in the mouth. And if you see this restoration, she looks being a 90 years old female, not a less than 40 years old patient. And when she came, it was smelling as hell. And when I understood when I removed the denture, and she was staying like this with all these roots, which have been eaten by the acids, by vomiting. And all of this was an infection. And the doctor told me, look, you should treat her, but be extremely cautious, because after each surgery, she will need to stay 2 weeks minimum at hospital, because all the figures will become red. Okay. And then I looked at the case. I said, first, we need to clean perfectly. And we cleaned perfectly. And we filled all the alveolar with NP3, which is a biomaterial xenograph coming from osteobiol, which is made of porcine material plus collagen. I've been using this material for over 18 years, and I know the success of this material, and I trust in this material. And I extracted everything, put a denture, and everything started to be very clean. She had no post-op problems, minor post-op problems for her. But everything went well, and I was encouraged to continue. And I started I would have done upper and lower, but you don't know with this patient how will they react. So I prefer to start with the lower jaw, and then come to the upper jaw. But after extraction, after 3 to 4 months, look at the bone we got, very minimum amount in the front, even less in the posterior, because if you look in the posterior, she was having 2-3 millimeters, no more, and nothing on the premolar, and nothing in the front. So that was extremely difficult case. And in the anterior, there was a little bit of bone from foramen to foramen. And I decided to place 5 implants, Amodium Brenemark, parallel, 5 implants from nerve to nerve, no specific thing, and just basic treatment. And of course, no immediate loading, because I don't know how would the bone react in such a case. And this is what we did. We placed those 5 implants parallel, and they stayed there. And we waited 6 months before second stage surgery. We were as far as we could with the nerve, and no ambulated abutment, no all-on-4, just basic treatment. That's all we need. We needed to be on the safe side. As everything went well, it was in the beginning of July, we decided end of July we would go to the upper jaw. And I planned, first of all, that I would just put a graft with a biomaterial, wait 6 months, and then place implants. This was a lower jaw. This is a lower jaw, sorry. This is a nerve. All implants are parallel. Everything went well. But now let's go to the upper jaw. And the upper jaw is an eggshell, absolutely an eggshell. It's empty, nothing. And treating cases like this with nothing, for me, is equivalent to growing an amputee leg, because it's empty, it's air. So I decided to open and see what was going on. You could see the floor of the nose here, and a knife, very thin ridge. And I decided, when I opened, to do the bilateral sinus lift. And I decided to place my implants at the same time, because after having compacted the biomaterial at the time of extraction, this bone became extremely dense, extremely hard. So I had enough initial stability to do both procedures in the same time. And it was a good thing because the doctor, his patients asked me to be as quick as possible and simple as possible, as safe as possible. So I decided to place the implants in the same time, narrow implants, 4 on this side, 4 on the other side. The space between implants to be able to maintain and clean, and I waited 6 months. Usually in a graft like this, with this kind of material, I wait 4 months. But this patient, I wanted to have the safety belt and be on the safe side. You understand why. But I waited those 6 months, and then after 6 months, I was extremely happy to see that all implants integrated. Everything was stable. I placed 8 implants because in case like this, you say, if you lose 1 or 2, you still remain 6, and with 6, you can treat the patient. Okay, so this is why I place those 8 implants, parallel, space between implants, perfect angulation, same in the lower jaw. But the thing is now, what about the stabilization of those implants? We started from nothing, just took biomaterial. A lot of surgeons tell us that I did the same for years, that the gold standard is autogenic bone graft. And I just had added this MP3, that's all. So I was anxious to see what would go there. How will be the initial stability? Shall I be able to treat this patient in a fixed restoration? You can see the X-ray of those 8 implants and 5 in the lower jaw, parallel. You can see, remember, we got 2-3 millimeters in the posterior. Look at the length of those implants. Everything is perfect. And then I decided to use Orstel because I wanted to see how stable was those implants and could I go to loading those implants. In the lower jaw, I got a huge value, which was 85. 85, you can almost hang the patient to the ceiling. This is incredible. But it's not so incredible because it's just basic basal bone. It's extremely dense. The problem of basal bone is blood supply. But I was extremely cautious when I placed the implants and everything went well. So in the lower jaw, I am on the safe side, 85. This is more than we need. But what about the upper jaw? I want to be on the safe side. So I don't think it would be a good idea to just load the implant without knowing what is there. So that's why when you do a bone graft with biomaterial or whatever, and you have a difficult case, and of course, when you have bone graft, this is a difficult case, it's extremely interesting, valuable to get these values of initial stability of those implants. And guess what will be the value in the maxilla? In the maxilla, we got 77, which is incredibly high. For nothing, we started with air, I tell you, with just MP3. And we measured all implants, the other side, 77. And in all the 8 implants, we were between 74 to 78. It means that with just biomaterial, starting with nothing, we were able to create dense bone, as dense as the bone we got in the lower jaw, which is absolutely incredible. And it means that now, in a compromised case like this, if we can have this kind of results, maybe we can use these biomaterials in many cases, in many grafts, because we are on the safe side, because this is an extremely, extremely complicated case on all aspects. But this is very interesting to see that I am not going to spend my time, waste my money and patients' expectation by just gambling. I know I am, and I know what are the values, and I know now that I am in a good shape, a good situation to continue and treat my patient in a good way. If the value were less, I would have waited more. This is a little trick to wait 1 or 2 more months and then measure again. If it went up, perfect. Went down, bad side. But We were able to do this definitive restoration. Everything went well. She can maintain. She's happy. You see the huge dramatic change in her smile. She comes from an old woman now to a young person as she is. And she came from this smile to end up to this smile, which is a dramatic change for her. She was so happy, extremely happy. And all my staff were extremely happy because she was such a nice person. She changed the smile now. And, you know, look at the dramatic change. She came from a miserable patient to a healthy woman. She was able to work again, give lectures, and she's now working in France with taking care of cows, pigs, animals, whatever, and having a good social life as well and find a boyfriend. So you see, we could do a lot for her. 6 years later, same, she's extremely happy. Look at the smile line. And you see, I was on the safe side because I used Zorstel. It's interesting. 11 years later, you see, time zero, zero problem. So we need to see the patient long time later. So look at the implants, perfectly integrated. Nothing is having a problem. Same thing in the lower jaw. Basic brain mark. We didn't lose 1 single millimeter in 10 years on this patient. And you can see this patient 11 years later, extremely happy. So you see, this is a help for these extreme cases. So I think that we need, in difficult case, to be on the safe side.